I'm Dr. Anthony Cave, a Stanford and Harvard trained anesthesiologist and integrative medicine specialist, and I support my patients with longevity medicine every day, and I like supplements. But I also am acutely aware of pitfalls that you need to be aware of so that you don't fall into scams that might actually hurt your longevity and make you age faster, where the risks of certain interventions might outweigh the benefits. Number one of the things that could totally take you down your heart or your brain prematurely is going to be this whole proverbial bag of bottles that I see patients bringing into my office all the time. I don't know who's put them on these, who has recommended them, maybe Instagram, maybe Facebook, maybe YouTube. I don't know. But it breaks my heart to see like 15 bottles. And the first question is, what's in those bottles? Is it heavy metals like lead, mercury, cadmium, arsenic? Has anyone actually tested to see what's in those pills or capsules in the bottles? Or are there microbial contaminants in that bag of bottles? Maybe some fungal or bacterial overgrowth that wasn't caught in a QI. Maybe there's pesticides, especially if they're herbs. Some of my favorite herbs, and I'll share with you in a minute what my top anti-aging topics are or supplements are, but what if you just concentrated all the pesticides from the plant into a little tablet and you're taking a tablet of pesticides? Maybe that bag of bottles has illegal prescriptions in there. So if you see the notes here, so if you're taking notes at home, you got to always be extra vigilant if you see something that is marketed towards increasing your muscle gains or improving sexual enhancement or sexual activity, or if it's there to lower your fat content. So these three categories are most likely to be adulterated with prescription medications, things like stimulants to just rev up your metabolism to lose weight, totally illegal and very dangerous. I have a whole video coming up on something that happened in the operating room with the patient who unknowingly had, I suspect, stimulants in their weight loss supplement. And then things like maybe steroid-like agents or anabolic compounds that are totally illegal that are in the muscle gain supplements. And then for the sexual enhancement supplements, there can be the phosphodiesterase inhibitors or the Cialis or Viagra-like medications illegally snuck in there. Totally illegal and very dangerous. Let's say you're taking blood pressure medications and you take one of these sexual enhancement supplements and your blood pressure drops dangerously low, just as an example. So what are the basic things you can do to help safeguard against this? Because like I said, I like supplements. I'm sure many of you do as well. And by the way, I'm going to monitor the comments. We'll get to them in just a second. And I want to know what your favorite supplements are. We'll go through them. But remember that you can look for third-party certification to at least minimize the risk of these types of contaminants in your supplements. The biggest three are NSF, USP, and CL. CL stands for Consumer Labs. I use that for my patients personally. So what have we got here? Oh, Heidi, thank you so much for reminding everyone to share. Jean is talking about skincare. So there are many of these contaminants in skincare products that can leach right through your skin. Absolutely. And they can cause long-term damage, no question. Sherry's talking about vitamin D and Equel. I don't know what the pharmaceutical name for Equel is, though, so you have to break that down, Sherry. But vitamin D is great as long as you know what your vitamin D receptor status is and what your levels in your blood are. We'll talk about that in just a second. Most patients have no idea about their vitamin D receptor status. MW, good to see you. Thank you for being a member. And methylene blue, SN, that is a prescription medication that's sometimes used under the counter in some ways or over the counter when it's not supposed to. So I can't comment on methylene blue other than what we use it in the operating room for. A lot of interesting research. We'll have to talk about that in a different video with the understanding that it's not supposed to be over the counter or prescribed without a physician there. And olive oil for my skin. Joey, I like olive oil. I like it better when you actually consume it, especially if it's extra virgin and it has not gone rancid, because rancid olive oil can take away a lot of those benefits. So number two, if you're learning something, hit that like button. Number two is what in the supplements are actually helping your heart and brain health. So this goes back to what is going to cause a shortened lifespan. Of course, things like smoking, because they lower your heart's lifespan, and they reduce your brain's capacity. Things that can lead to perhaps early onset dementia or neurodegenerative disease are going to land you in bed longer. That's going to decondition your heart, presumably, and that might be how it ultimately takes you down. Now, the very common supplements out there, I've listed just a handful. These are things that I personally like to use, and in many patients, they have a specific reason to benefit from these. I've listed them here. Turmeric, which is the, we believe, active constituent in curcumin, or pardon, curcumin, the active constituent from the turmeric root, CoQ10, NAD and its closely related molecule NR, glutathione, and C15. Now, this does not mean this is for everyone. This is not doctor advice or medical advice at all, but this is just an example of like, these are the most common things you might see online, but are they actually helping your heart or brain last longer? Well, you need to answer that question by understanding your specific body and what you are most likely to succumb to based on things like your genetics, based on, for example, your bone density from a DEXA scan. Because if you're trying to preserve your heart and brain, but you fall with osteoporosis and break your hip, that could be what prematurely ends your life, even if you have the healthiest heart out there. Maybe you know someone who has had a history or a family history of osteoporosis and had a premature death from that. It's much more common than folks think. Maybe your heart rate variability has been measured and has demonstrated a serious detriment in your heart health. And you need to focus your supplements and the rest of the techniques we'll talk about based on your heart health, because you specifically are at risk. Your lipid panel, your lipoprotein A, which most folks have no idea what their status is, or their coronary artery calcification score. And I put OSA in here, which is obstructive sleep apnea, because many folks likely have sleep apnea, have never been tested, and are just at risk of having all sorts of heart conditions and mental health conditions from poor sleep and the stress that puts on the heart and the brain. And what are the heart and the brain? The two organs that are most likely to impact your health span and lifespan. So if you're trying to figure out what supplements are right for you, you need to make sure you know what your body needs. And it's not a one size fits all. And you don't want to be putting unnecessary supplements in your body, because like we said, for number one, there can be a risk for those. If this makes sense and you're liking and learning something, please share this with others. Yes, I do agree, Anna, this stuff can be scary, and we absolutely do not want to just load our bodies with supplements that are not addressing what our body needs for its longevity. And sun exposure, oh my gosh, we haven't even touched on that part of your longevity, but that's huge, no question, Gene. That is so important to not forget, because how you look also impacts your long-term health as well in so many ways. So I hear that Francis, your mom died from a hip fracture after her cancer treatment was successful. How heartbreaking is that? Francis, I'm so sorry. I hope others here also can learn from the story you're sharing, because it's not just about anti-aging, it's about what your body needs specifically. Very good. Very, very good. Thank you for sharing that story, but I'm sorry, Francis, about that. And then is the biggest, oh my gosh, this is like the biggest facepalm for my patients who are doing what's called the skipping of the foundation. It doesn't sound sexy to talk about things like microplastics or the water you drink or your quantity and quality of sleep, your mental health conditions and what your maintenance is there, your diet or physical activity or conviviality. But if you don't have that basic foundation set, that's like 80% of your longevity right there. All the supplements, all the interventions, all the procedures, which have risks, cost a lot of money, and could even go sideways, are maybe the 20%. I don't have a specific number, but it's likely an 80-20 rule. If you know what I'm talking about, let me know below. Because 80% of your longevity will come from those foundational topics that I just listed. 20% is going to come from optimizing every last micronutrient, unless there is an overt genetic issue or an overt disease condition. That's different. But for the average patient who comes my way, those foundations are important, because sleep absolutely impacts your heart and brain health. Your water content, if it's filled with either plastics or other toxins, and you're putting that in your body every day, multiple times a day, can absolutely impact your heart and brain health. Microplastics have a scary, scary association with neurodegenerative disease like Alzheimer's, dementia. What good is a healthy heart if your brain isn't around to communicate with anyone in a meaningful way? What about diet and all the millions of folks that will die on a hill for their diet recommendations? Well, the very easiest thing, which I must say is not medical advice to you, but I discuss with my patients if it's right for them, is just following the Mediterranean diet. Very simple to do, does not cost that much money, and likely has a far bigger impact than the majority of supplements that people are putting in their body. Physical activity, needless to say, is important. 75 minutes, 150 minutes, as you know, for moderate and vigorous intensity activity a week. And then the conviviality component. No one ever talks about this. Heck, I never even heard this word in all of medical school. Does anyone here know the importance of conviviality? I am so curious. I will give you a massive shout out if you've ever heard of the role of conviviality in life extension. Debbie, I'm thrilled to see you on here as well, by the way. And I'm happy that Joey drinks water all day. I hope your water has the appropriate filter based on what is in the water supply of where you live. If you're in the United States, it's very easy to measure what's in your water supply. Candy, sounds like you haven't heard of the conviviality component either. Most folks have not, because you don't make money in pharmaceuticals by encouraging people to maintain healthy social relationships. The effects of loneliness on the body are equivalent, if you really want to be academic about it, to several cigarettes a day. I disagree with how that's computed, but as a general qualitative measure, that's pretty darn scary to me, and it should be to you as well. The social isolation or loneliness that can come from various mental health conditions or just how we choose to live our life can have a much bigger impact on your overall longevity than all those supplements that patients bring to me in a bag that might have the heavy metal intoxication or the microbial contamination as well. So recognizing that I love all of these components to your longevity and your overall health, you have to have the foundation set first. And I hope you can appreciate that if you're going to try to preserve your heart and brain for a long lifespan and a long health span, you have to be targeted and intentional about all of your work. And a lot of influencers on social media will just push random supplements that limited to no data, and certainly not knowing anything about you specifically either. You wouldn't want that for yourself, and nor would I, because your healing capacity comes from you working with a healthcare provider and a healer who knows who you are. It's more important to treat the person who has a particular disease than to treat the disease that a person has, is a common saying in modern medicine. So with that said, let's do a couple of Q&A questions. And Layla, I'm happy you learned about conviviality. Social isolation, a huge part of your depression. Susan Lawler, I hope it has gotten better for you. Very good to see you, Susan. Cannot be understated, Susan, how important that component is. Heidi, I agree with how many supplements are pushed without any good rationale or any safety data on social media. Since my husband died, I see isolation trying to set in. Need to work to reach out. Yes, Judy. I'm sorry about the passing of your partner. I am hoping that you can maintain your resilience to not fall into that trap. The first step in losing our connection with ourselves is losing our connection with others. Hugs and kisses. I'm happy to catch you here as well. Thank you for the kind comments. How can I bottle your energy for myself, Kimberly? Gosh, I don't know, but I think it would probably start from the foundation. Sleep, conviviality, diet, physical activity, mental health is where it all starts. Of course, the supplements are great and I love them, but they have to come after your foundation is ready to receive them. Sherry, so many supplements are pushed in ads by influencers. And how many of them are actually doctors, and how many of them actually know what's right for your body, which, as we discussed, is not the same needs that another human body might have right next to you? Karma's doing well, Joey. Thank you for asking. How can you work on conviviality if you have chronic pain? You need to address the chronic pain, is the first question. Not all forms of chronic pain can be treated at the root cause, but many can. It's one reason many folks come to me in San Francisco, so we can use our therapeutic options for chronic pain treatment, because chronic pain and emotional pain have a tremendous amount of overlap. You cannot treat one without fully addressing the other. They are very closely related, and it would be unfair for any doctor to assume otherwise. It wouldn't be right for the patient. I would say one supplement per annum. Well, Anna, that's not, I would love if it just one supplement suffices, but some individuals' bodies have requirements for more than one supplement. Some may have a requirement for no additional supplements. So I would say it depends on the individual, but it would be ideal to use the fewest number for the greatest benefit. Maybe join a book club. I love that, Polly. Thank you for that suggestion. Stacy, I don't worry about looking better, just feeling better through food and physical activity. I appreciate that. It would be perhaps naive for us to say that looking good does not have an impact on feeling good, to a degree for many folks. But that being said, Stacy, I totally appreciate where you're coming from, and I respect that very much. I hope you're an inspiration to many others as well. Homozygous familial hypercholesterol plus a separate gene for high LDL. So the CoQ10 with statins is not a bad approach. It doesn't work for everyone, but that's one example where you need to know your specific biomarkers for what's going to take your ticker down, or your computer processor up there down earlier than it needs to. With that said, I hope you all learned something new. Please, as you know, subscribe to keep up with all of our content here for medical advocacy. And remember that you have more power over your health than you've probably ever been told. Let me know in the comments what you'd like to learn about in our next live stream. Until next time.